Fevers are so common in kids, and there are certain things about fevers that make us worried. One of the scenarios that we see more frequently than I would like is the scenario where you have a girl under the age of 2 who runs a fever over the 102 with no other symptoms. So if there's no symptoms, you know, as far as like a runny nose, cough, congestion, gooey stuff everywhere, outside of that scenario, if they have fever without a source, then I would get a little bit more concerned. That might be something we ought to go ahead and take a look at. On the one extreme, you have the possibility that it's something very simple, Roseola. Roseola is a very interesting germ because all it does is that it gives a kid a fever, 102, 103, 104. They'll run it for about 3 or 4 days, and then as soon as the fever stops, within 24 hours, they break out in a rash from head to toe. And by the time you get to the rash, you know that that's Roseola. But until then, all they're doing is just running a fever, and usually in between the fevers, they're feeling pretty good. You know, so the other end of the spectrum is something a little bit more serious, which would be a urinary tract infection. So bladder infections in little girls happen there's about a 20 to 30% chance of having a bladder infection in that scenario of fever with no source. So if we have a little girl, she's running a fever, comes into my office, we can't pinpoint it as far as seeing an ear infection or seeing a throat infection, and we're kind of figuring out what we're going to do about that. Oftentimes I'll use that time frame as a way to measure whether or not there's something that needs to be addressed. So I usually say, your kid is running a fever, but we're non-toxic appearing. In other words, in between running a fever, we're acting pretty good. We don't have anything to blame it on, and there's nothing on physical I can tell you exactly what's causing it. But if it runs past that 4th day, then we definitely need to recheck that child and make sure that we don't have a urinary tract infection. Oftentimes I won't do it in the very beginning because it involves a catheter, you know, so it's not something that we'll jump to right away, and it could still be that Roseola, you know, but that 4-day sort of time frame that we see normal viral infections cause fever is okay for us to wait as long as the child's drinking and acting okay. Once you get past that 4th day, I really like to have them back in again so that we can discuss some of the workup that we need to do, whether it's blood work, urine, or both.